Infection of joints, also known as septic arthritis. What is septic arthritis? Septic arthritis is an infection in the joint fluid and joint tissues. It happens when bacteria, viruses, or fungi spread through the blood from another part of the body, or enter directly through an injury or surgery. Key characteristics of septic arthritis. Septic arthritis is a fast-acting bacterial infection inside a joint. That is a medical emergency. It has following key characteristics. Monoarticular nature. In approximately 80% to 90% of adult cases, the infection is isolated to only one joint. Predilection for large joints. The knee is the most commonly affected site, followed closely by the hip, shoulder, and ankle. Prosthetic vulnerability. In artificial joints, the infection behaves more subtly, presenting as progressive joint loosening and deep pain weeks or months after surgery. Severe local pain. The joint becomes highly painful, swollen, red, and hot to the touch. Sudden onset. Symptoms develop aggressively over hours to a few days. Absence of fever. While a systemic classic triad of fever, pain, and limited motion exists, fever is absent in up to 40% to 50% of confirmed cases. Inconclusive blood work. Standard inflammatory blood markers, like white blood cell count, CRP, or ESR, are highly nonspecific and cannot definitively rule out or confirm the infection on their own. Synovial aspiration required. The absolute hallmark of diagnosis is analyzing the joint fluid via an arthrocentesis. Purulent fluid profile. Infected joint fluid typically reveals a highly elevated white blood cell count, often exceeding 50,000 to 100,000 cells per mm cubed, with over 90% polymorphonuclear leukocytes. Chondrolytic destruction. Bacterial enzymes and the body's own immune response can completely destroy joint cartilage within 24 to 48 hours, if left untreated. Surgical urgency. It is handled under the clinical rule of septic until proven otherwise, requiring emergent joint decompression, drainage, alongside targeted antibiotics.